transmission. But viruses are microscopic organisms and very, very minute, they are measured in nanometers. They can spread through touch, exchanges of saliva, coughing, all the secretions, contaminated food, insects, person to person. Okay. Apart from corona, there are many other viruses like measles. There is a measles epidemic also going on in Mumbai. So these are different kinds of viruses. There are various sizes, shapes, and there are various mechanisms. The coronavirus particularly, go to the next slide. These have got radiation, spikes kind of thing. That is why it is called corona, means like a flower. What these spike protein do is, they help the virus to get attached to the cell. So once they enter your body or into a respiratory passage, they can cling to the cells and then get into the cells. What after that happens is this is the green thing, is the genetic material inside the virus that gets drilled into the cell, and the genetic material reproduces to form new virions, and once then it disrupts the whole cell. The cell breaks and the virus are released and further infect the other cells. Next slide. So this is the nanostructure of the coronavirus actually. As you see, outside is the spike protein, then the green layer is the membrane protein, then there is an envelope protein also, and inside is the genetic material. So this is a RNA virus. The virus is mainly, the entire family of viruses is classified into DNA viruses and RNA viruses. So coronavirus falls into the RNA category. So when you are testing for that is where the difference comes. Everybody has heard of RT-PCR, right? Anybody can tell me the long form of RT-PCR? RT-PCR is everybody knows, but what does RT-PCR stand for?
Rapid test.
It's not a rapid test.
Polymer chain reaction PCR stands for.
PCR stands for
Polymer chain reaction.
polymerase chain reaction. RT stands for?
Real time.
It's not real time.
RNA.
It would have been RNA then, RT. So RT stands for reverse transcriptase. So it's a reverse means since it's a RNA virus, normal PCRs are used for DNA viruses. When you have to look for RNA viruses, which is a coronavirus, you have to do a reverse transcription. This is a complex genetic technology. I won't be going into so much of details, but remember, RT is a reverse transcriptase meant for RNA viruses. Next slide. So as I told you, first the virus gets attached to the cell. This is called adsorption. Next, it enters the cell. The genetic material is injected into the cell. It multiplies. It replicates. The genetic material replicates into the cell, forms multiple assemblies, forms new virions, breaks the cell, and multiple virus particles get liberated, and then they infect other cells. So this is how the virus spreads. Now then again, one person can infect multiple others because he is producing more viruses into his own system. But the virus itself cannot use his own genetic machinery to replicate. That was the first difference I told you, right? They cannot reproduce on their own. They have to use the cellular machinery of the host cell. Next slide. Now, as you all know, all these different first wave, second wave, third wave, now we are on the verge of a fourth wave. Still we are not on a wave. We'll be giving you some statistical data on as to where we are standing currently at India as a country. We have seen all these variants, alpha, beta, gamma, delta. Now there's one more which has come up recently, which has been detected in the US and in China. China is suffering a lot many cases. So what happens exactly? Why are we getting these variants? The virus itself genetically mutates. Mutates means what? It changes itself the genetic material, and which our immune system cannot detect. Now we will be wondering, when we have taken 2 doses of vaccine, why are we still getting corona? It's because of the mutating genomic sequence in the virus. Next slide. Variants of concern. We had Omicron. The first wave was alpha. You remember 2020. Then we had Delta. Then we had Omicron. Latest was the Omicron. So there are various genetic mutations that are happening over the period of time. Of course, doctors are also relatively new to this virus. So all over the world there are researches and studies going on as to what medicine really works, the behavior of the virus, the time taken for a genetic mutation, and whether a particular mutation will be lethal or not, or cause serious infection. That is the cause of concern. Next. Modes of transmission everybody knows. Okay? Infected droplet, somebody sneezes, coughs loudly. In fact, this is so virulent, somebody talking at this distance is also infectious. That's why we were wearing masks. Remember? Those who had religiously used masks and were not in contact with the patient got away with without getting infected. But unfortunately, even if you are 15 minutes close enough to a person who is infected, then you are likely to get infected. The previous slide, the mode of infection. Then direct contact. Direct contact means you shake hands, you touch something which has respiratory secretions from another person. Close contact with infected eyes, nose, then again touching the same hand to the lift, elevator handles. But of course, this has not been proven to be very infectious. The primary mode of transmission, again remember, is direct face-to-face contact. Okay, that's why wearing masks is protective. We are still not reached that stage where the infections are rising that rapidly. Maybe we'll have to insist on wearing masks if we reach that stage. Next slide.
Just to add something.
Yes.
Basically, as a proactive measure, what we have already started, we are not asking for masking, but whenever this type of meeting is happening, so maybe 15
We can
people,
practice some social distancing.
15-20 people there, then we are asking voluntarily, but masking is needed. Most importantly, we are asking such people who are traveling, maybe from abroad, maybe inter-India district also. So they have to send declaration and they have to route through vaccine. Very importantly, normally what we are asking, basically if you are.
So mode of transmission, we won't go into the pathophysiology. As I have already explained you, it enters the cell, the genetic material replicates into the cell, the cell explodes and releases more virions, okay, which are the daughter cells, and then infects further cells. Next slide. Symptoms everybody knows, as sir was saying, anybody having cough, sneezing, running nose, fever, with or without chills, body ache. Sometimes, rarely it presents with diarrhea also, vomiting and diarrhea. So any vomiting, diarrhea also can be a symptom, though not a primary symptom of corona. Can be a symptom of it. And this one is the most important. I will be talking about this. This is very typical of corona. Is loss of taste and smell. In every viral fever, everybody I am sure has fallen sick sometime or the other. You lose taste. That is common with most of the viral infections. You cannot, particularly those who are fond of tea or coffee, just don't like tea or coffee or cannot get the proper taste of tea. So that is the taste loss of sensation. For smell, what you can do is keep something camphor or maybe any pungent substance into a plastic box. Seal it with a parchment tissue paper and make some holes. Every day make it a habit. Camphor is a good option because it's antiviral also. Daily before you come to duty, you can just smell it. Keep it at a distance of about 3 finger breadths from the nostril, and see whether if you are able to breathe it, to recognize the smell correctly or not. Okay, this is camphor and nothing else. So if you are able to smell things, you are unlikely to. This has been proven to be as specific sign and symptom as RT-PCR. Means those who are RT-PCR positive usually lose smell. Of course, the sensation comes back after you recover from COVID, but this can be a warning sign that you must consult a doctor, or at least quarantine, as sir said. You stay away, stay at home. Particularly if you are working in crowded places where there are many other fellow co-workers, see that you maintain social distancing. We are not sitting very close, so we have to be at least 6 feet apart, and then wear masks. Okay. So this was about the smell test. Taste test is you cannot really enjoy your food. Next. Coming to the very important walk test. Everybody knows the pulse oximeter. How many of you have a pulse oximeter in the house? 1, 2, 3. You know how to use it? Those who don't have, if you doubt your oxygen saturation, you are feeling breathless, get your oxygen saturation checked at the OHC. Okay, it's a simple device. You put your finger into the crocodile shaped portable device. It will give you your pulse reading and your oxygen saturation. Okay, so this you can do at resting level also. Your resting pulse has to be less than 100, and then you can walk for 6 minutes. It can be a normal walk or a brisk walk. Ideally a brisk walk. It can be a longer walk also. After you come back, within first 30 seconds, put your finger in the pulse oximeter and check your saturation. If it is falling below 95, there is cause for concern. If it falls below 90, you must see a doctor. Okay, and below 85, somebody needs oxygen. You cannot survive without it. If your oxygen saturation is falling below 85, you are going to need oxygen support. Okay, that's why there was a mad rush. Everybody was following news, right? Last year, mad rush for oxygen because this virus affects your air exchange in the lungs, and ultimately you fall short of oxygen. So that is the end result. So this is how a COVID test is taken. Those who don't have pulse oximetry, feel free when you are entering the company. The OHC is right there. Feel free to get your oxygen checked. Okay. And one more thing, one more precaution we have done there is we have installed a thermometer. It's an infrared thermometer right at the entrance. So when you are entering, make it a habit that you check your temperature. I think the protocol has already been started, right?
Yes, sir.
Anybody who is having a running temperature more than 38 will be declined entry into the hospital unless certified by either the nurses or me or Vasan sir. Nobody above 38 will be allowed entry. Okay, we might recheck if there is a doubt. If you have walked, you say that you have come from sunlight, heavy sun or something, we'll recheck at 10 minutes. But if a persistent above 38, you can self-check at home also. If you are feeling a little feverish, please do abstain from coming and you can take a 2-3 days break. That was about the thermal screening of temperature.
This is provided to all the departments.
Great. So the department itself, if somebody is feeling breathless, not sure whether maybe COVID, not COVID, I told you a simple test also, the breath test. You can smell something like camphor in your
Present is stop, right? This practice is present is stop. Now we can start. Well, consider we not start immediately.
We are monitoring the cases. Today morning itself, I tried to see NDTV, and then India has about 30. Maharashtra has about 35 active cases as of today of the last week. So the last week statistics. But you never know this. Suddenly there can be a surge.
Sir, it is a new variant you are talking about.
Of the new variant. Can you go to that website? Okay. Because today morning I was trying to get the data, the recent data as to where we are standing. There's some good program going on. They say we'll wait for you for 20 seconds. And then you go and wash your hands in between. This is a good hand washing technique and hand washing video. Ideally you should wash till the elbow and see that your interweb spaces are properly clean. And wash for 15-20 seconds. With the knee. There are very good videos, I can show you those videos also later on. The proper hand washing technique. Okay. That will ensure a good hand hygiene.
They all have
Because
some food, so they have to wash their hands.
so hand hygiene is very important for you.
This is displayed in every
Scrub technique, no?
Great. That's scrub technique, you know. The
Scrub
proper
technique.
hand.
YouTube
And
allow?
ideally use a liquid soap.
Yes.
Okay. Next slide. Social distancing we have talked about the previous one. COVID vaccination everybody has done. There was a news, I am not sure about the latest. A week back, Bharat Biotech is launching a nasal spray vaccine.
Yes, sir.
So once I get hold of it, I'll be procuring and we'll be giving it to you. And it has heterologous vaccine protection also. So meaning if somebody has taken Covaxin before or Covishield before, you can still take the nasal vaccine. So once I get access, they have still not opened. But
Only pricing is
pricing is given, it
negotiable.
is about 800 rupees per dose. 800 to 1000, that is what the government has announced. But we are not able to order it till now. So once we get that, we will give you those shots. Washing hands, of course. Cover your mouth. If there are active cases, of course, sir will take a decision on when to enforce masking. Till now, everybody is comfortable without a mask. But maybe we'll have to again wear masks. 6 feet distance, we cannot be so close if we have meetings. We had marked those chairs, remember? That one chair next to other, so that kind of social distancing. Fraudulent test results, you know. Try to don't spread false alarms, and report any fraudulent tests or somebody not vaccinated and then generating certificates. All these things should be avoided. Take vaccines, that is there for your protection. Next. There is no specific treatment, by the way. For Delta, if anybody gets RT-PCR positive, unfortunately, there is a new therapy called immunomodulator. You know, they give you the antibodies. It's called a lytic cocktail, where the two antibodies they are injected into your body. Within 24 to 48 hours of you testing RT-PCR positive, they are called monoclonal antibodies.